You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hello, friends. Welcome back to Nurse Converse. Hello to our old listeners and our new listeners, wherever in the world you are tuning in from. My name is Lily, and I am so excited to be back with Nurse.org to talk about another topic which I think is especially important for nurses and honestly anyone who works in healthcare, and that is hobbies. Whether you are a nurse, a nursing assistant, nursing student, NP, RT, doctor, lawyer, baker, astronaut, whatever, I think it is so important to take yourself out of your field of practice and into something completely different when you aren't at work. And in this episode, I will be discussing why. So let's dive right into it, shall we? I want to open this podcast with a lesson I remember learning in my 5th grade health class. And I feel like no good story starts that way, but I promise this one has a point. I remember the day we learned about empathy and kindness, and my teacher used the analogy of everyone having their own bucket. She had a physical bucket with her and had a few slips of paper in it with really kind things written on them, which she handed out to us. And at the end, she told us, "I've given everyone else something out of my bucket, and it's great to make other people happy, but now I have nothing left for myself. My bucket is empty." Boy, that one stuck with me. You can't fill anyone's bucket until you've filled your own. I've been going around using the term fill your bucket ever since. I feel like hobbies are one of those things that are so prevalent and abundant in your childhood and adolescence, and then once you reach adulthood, they can get harder and harder to maintain. Personally, growing up, I did acting, singing, piano, soccer, basketball, cross country, and track. And the most important thing I can note from having those experiences in my childhood is that it helped teach me my sense of community. It expanded my world, introduced me to people I shared common interests with, and taught me how to make friends before I fully had the skills to navigate doing it independently. When you're in school, it is so easy to pick up a hobby. If you want to learn how to cook, all you have to do is go and show up to the cooking club. You don't have to go through the Google spiral of cooking classes near me, or cooking classes near me that are affordable, or affordable cooking classes near me with good reviews where everyone's really nice and they also don't know what they're doing, and also how do I make friends as an adult? It's really hard. It is. The structure of school was safe and comfortable and easy. And once you leave school, starting something new can be really, really hard. I remember the first summer after I graduated nursing school and passed my NCLEX, I had a moment where I sat there and I was just thinking, okay, what am I supposed to do with myself? I had constantly been in plays or on sports teams essentially my entire life up until that point, and all of a sudden I was just lonely and bored. I wanted to be a part of something bigger than myself outside of work. I craved the feeling of being on a team, and I needed a community. So I kind of panicked and I stress joined a YMCA. I'm laughing because looking back, it's just funny to me that that's the first route I took to get what I needed quickly, but I absolutely loved it and I had such a ball. I was fresh out of college and probably the only person under 65 in my Zumba class, but let me tell you, those ladies could dance. I genuinely loved it, and it was a great start to finding out what I liked to do and what made me feel whole outside of work. There's a lot of evidence out there about how important it is to have hobbies outside of work. But when I started actually doing my research for this episode, I was a little shocked to see the lack of research that has been done specifically on the nursing profession. However, I did find one study which really caught my interest. The study is titled Effects of a Hospital-Based Leisure Activities Program on Nurses' Stress, Self-Perceived Anxiety, and Depression, a Mixed Methods Study. It was done in a Chinese tertiary hospital to measure how nurses in specific reacted to a leisure-based program within their hospital. The program had a bunch of different activities, including dancing, tai chi, calligraphy, painting, photography, flower arrangement, cooking, and learning English. In the end, the results of the study are not so shocking at all. The self-perceived anxiety and depression of the nurses who participated decreased significantly. Of course it did. Just the mere thought of sitting there and arranging flowers brings all the happiness and butterflies and puppies and rainbows into my heart. The study elaborates on 5 themes involved with hobbies that were discovered by Newman and co-authors that help break down the positive benefits of leisure. In other words, if you're making a leisure salad, here are your 5 ingredients. Number 1 is detachment recovery. This is the act of actually stepping outside of your stressful environment and allowing yourself to have the space to recover. Detaching from the stress and detaching from what fills your brain for so many hours of the day. Giving yourself the space in between is what's going to help give your mind a break, let it heal, and over time contribute to your resilience as a nurse. Number 2 is autonomy. As nurses, one major thing we strive to maintain is the autonomy of our patients. But it's important to allow ourselves to experience it too by choosing things that we want to spend our time doing and things that make us feel fully satisfied and happy. Number 3 is mastery. Learning a skill and working to become good at it. Receiving those positive emotions from challenging yourself and growing over time. Number 4 is meaning. Adding purpose and understanding to each of our individual lives through what brings us enjoyment. And lastly, number 5 is affiliation. Expanding your social network, meeting new people, and finding a sense of community and belonging. Hobbies are important. In their own way, they're self-care. They're a gift to yourself, which you deserve to have regularly. And to bring it all together, the hypothesis of this study is essentially saying that nurses who participate in leisure activities can have decreased depression and anxiety, which can impact quality of care and patient safety. It's one of those things that seems like it's obvious, but after reading it, I kind of had a moment of re-realization where I was like, oh. Because if we're not feeling fulfilled and we are constantly coming into work with an empty bucket, it can reflect in our care, and our patients can feel that. Now, this study was done with a leisure program built within the hospital setting, and I don't know about you, but I've yet to come across that in my nursing practice thus far. So, that means some effort is required to start a hobby, and it can be difficult sometimes. You really have to want it. It is very easy for me to say, go pick up a hobby or try this and try that. But at the end of the day, especially in healthcare, there are a ton of barriers to having access to hobbies, which can deter people from even starting in the first place. I actually think nursing can be one of the professions that has the most barriers towards finding fulfillment outside of work. I mean, what are the first few things most people outside of healthcare talk about when you mention nursing? High-stress job, long 12-hour shifts, no time to break, no time to pee, traumatic events on the regular. Life at work is hard. And outside of work, people have lives to attend to. People have children and family members to take care of. Houses and properties that need to be maintained, errands to do, and doctor's appointments to go to, so where even is the time? By the end of the day, when all is said and done, I don't know about you guys, but after work and on my days off, my bed is looking like a burrito that I just want to spend my whole life wrapped up in. My advice is trying to find at least 1 hour in your week to dedicate to yourself. I know it's hard, you guys. Outside of work, our time is precious, and we're very conscious about how we spend it. The thing is, when you're doing something you love, you want to spend time doing it. You are present. While you're doing it, time flies. And you don't need a lot of time either. The nurses in that study only did their respective activities for 40 minutes each week. You don't have to reinvent the wheel here and uproot your whole schedule. There are 168 hours in a week, and you need just one of them. Just one. You deserve that time. And you owe it to yourself. If you have children or family members that you have to care for and you can't get that hour to yourself, it might be worth it to find something you can do together. Not only will that still give you your benefits of detachment recovery, mastery, autonomy, meaning, and affiliation, but it'll also promote bonding and give you a shared experience which you can relate to each other on. Another barrier is resources. Maybe you don't have the money to invest in a new hobby or the transportation to get there. The good thing is, there are so many hobbies that are cost-effective and even free. Hiking and being in nature, going to the library to pick up books, or watching tutorials online to learn how to draw are just a few examples of things you can do. One advantage of social media is that we are living in the age of connection. We have access to endless free resources online and endless virtual communities who share our same interests. Plus, if you can't find what you're looking for near you, you can always start it. If you want to go to the beach and go on a walk, invite people with you. Tell them to invite people and tell those people to invite people. And then make plans to do it again next week for whoever can make it. Community grows, and it has the power to grow fast. You'd be surprised at how many people out there want to be a part of something but are too afraid to take the first step. Additionally, I think it's important to note that hobbies can be solo. You don't have to take expensive classes or find a group of people to do something with. You can just do it. There is absolutely no shame in doing something that you enjoy by yourself, and there is nothing to fear. Which brings me to the last barrier I want to touch on today: the fear of failure. It's hard because a lot of the time growing up, we're taught that if you fail, you're bad. But we have to reshape this thought to if you fail, you're learning. Failure and the thought of being bad at something tend to scare us away from starting new things. But if we reshape our thinking, failure can be our greatest teacher and lead us to mastery. One of my favorite hobbies currently is pottery. When I started doing pottery, I had a really hard time at first because I was not good. I was sitting behind the wheel like, after literally 25 years of never doing this in my entire life, I can't believe I'm not good at it. As an adult, I feel like there's this unspoken expectation that all of a sudden you're good at everything. And my hobbies have humbled me beyond belief and have taught me truly how important it is to try and try again at something, to grow, to be challenged, to fall and get back up. Because surely those are lessons that follow me in my career as well as my day-to-day life. If you're struggling on where to start or what to do, realize that you may have to do a little shopping around of your hobbies. And by that, I mean, you might have to try a few and realize, that's not for me, before you find the one you really want to stick to. I posted an Instagram story and I asked some nurses to respond to me with what some of their favorite hobbies are. And the answers were just fantastic. The responses I got were crocheting, working out, reading, traveling, hiking, walks on the beach, yoga, Latin dancing, pottery, photography, and lastly, melting on the couch. Which I do think we all need to do sometimes. But Wow. I think it really goes to show that nurses are such versatile human beings, and once we step out of that comfort zone, we can truly do anything we put our minds to. It is so easy to get caught in the vicious cycle of, I don't have time to do this. Nursing is stressful, and at times it can feel completely overwhelming and bleed into different areas of your life. But it is so important to note that being a nurse is only a fraction of who you are. You do not have to put yourself in a box and confine yourself to just one thing. You are a dynamic, evolving, and ever-changing human being who can do anything they put their mind to, as long as they have the motivation to do it. I mean, hey, you got through nursing school. Truly, you can do anything. So, to summarize, making sure our patients are given the utmost care and that they are safe within that care are two huge focuses of the nursing profession. Doing things that make you happy and living a fulfilling life that you enjoy can help bring you into work with a more positive mental state and allow you to tackle the struggles and stressors that are thrown at you in nursing and help you build your resilience. Not only do our hobbies affect our practice, but they teach us lessons in our day-to-day life, which can help shape us into well-rounded, versatile, and skilled human beings. Relax, take a deep breath, and fill your bucket. As always, thank you guys so much for tuning in today, and thank you again to Nurse.org for having me. I really hope you found some value in today's pod. If you have, and you enjoyed this episode, I ask you kindly to leave a rating or a review, and don't forget to subscribe or follow on whatever platform you're listening on so you don't miss the next episode. If you want to follow me, you can find me on Instagram. My handle is @I'mLilyMadelyn. And also, you guys, if there are any topics that you want to hear, shoot me a message. I am always looking to see what topics are hot and what people want to hear because truly, we couldn't do this podcast without you. Thank you guys again. I can't wait to chat more. Bye for now.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.